Specialty pharmacy definitely has impacted oncology. When you think about it, it used to be infusion at the oncologist's office, et cetera. Now, with the advent of all the oral products over the past couple of years, there's really been an impact. What's the value? Can we give a concise value of specialty pharmacy and oncology? So, Cheryl, I'll ask you that question.
Sure. I think, as we see those therapies go from traditionally infused to now there are oral options for the patients, we've seen patients who do need that high-touch support. So you're taking the patient from a setting where the doctor and the staff could administer the product and see that the patient did get the product and how their response is. Now we have patients who are taking their therapy on themselves. So if we truly want to see clinical trial efficacy in the real world in some of these oral therapies, the need for high-touch specialty pharmacy to be able to reach out at first, educate the patient, and then continually check in on the patient and be that 24/7 resource to help support the patient along their journey, incredibly valuable in the oncology space.
And I think as well, the importance of focusing in on providing patients with side effect mitigation strategies proactively, letting patients know when the expected side effects occur. If it is, between day 3 and 5, you might see this. Between day 10 and 14, you might see this. And here's what to do about it. To let patients know that the specialty pharmacies are there when they encounter an unknown side effect, but also to have that proactive education that, okay, this is not out of the norm, this is not something unusual, this is what will most likely happen, and this is how you can manage through it.
I totally agree. Managing or, promoting the education piece of managing expectations is a winner for the patient and the manufacturers. And I think sometimes manufacturers have put together wonderful starter kits that offer some over-the-counter treatment options for side effects and side effect management. I know we've personally worked with providers and put together side effect management kits where we'll automatically give them out to patients with certain medications. And when we're educating the patient and telling them when you expect, if you do experience a rash, this is what your physician has instructed. And here's the tools we're sending out with your medication that you can treat those symptoms.
Yeah, patient management is really a key differentiator for specialty.
Sure, designing those patient compliance kits is very important. One of the things, so we do that as well when a therapy has attributes that would, cause patients to possibly experience certain side effects. One of the things that we've found very helpful to patients is also tip cards. So along with the compliance kits that we send out as their starter therapy, right, we have tip cards. So we've gone over the phone with these patients what to expect, and then should they experience one of these side effects, then this is what you will receive. Say it's diarrhea, then we provide an anti-diarrheal. We'll talk them through that. We also talk to them about dietary habits that they can do to help avoid that diarrhea. But sometimes, they'll need that tip card just to go back over. Mm-hmm. And I know in our education component, our clinicians are also referring to the tip cards to get the patients used to going back to and reading that information.
So I think one of the additional values of specialty pharmacy as well is really ensuring that communication loop between the patient and the provider and the specialty pharmacy is closed. And in that way, the specialty pharmacy can really act as the quarterback for the patient's care as it relates to their medication and their medication concerns. So I think that's an additional point that that is very clear to the value of specialty pharmacy, and also and how that can relate to oncology patient management.
There's a robust pipeline for oncology products. In fact, IMS Health calculated that 22 new oncology drugs came on the market in the last 2 years. Additionally, the pipeline remains strong in that 1/3 of the drugs in preclinical and phase 1 development are oncology products. What impact will this have on oncology management, Cheryl?
You know, there are wonderful technologies in the pipeline, great advantages for patients. I think one of the impacts is going to be the value of the benefit investigation, understanding where these drugs are covered, whether they're on the medical side for the healthcare practitioner administered or over on the pharmacy side for those. So great leverage that specialty pharmacy can play to be able to quickly identify the benefit and then move on to uncovering financial barriers if they exist.
What effect will this have on specialty pharmacies and payers, Renee?
So with so many of these new oncology drugs on the horizon and some of the new mechanisms of action that have the oncology community really excited, I think the payers really need to understand, you know, what position they will have in the clinical therapy and how they can best manage it. It's exciting because the patients, there's lots of advantages. When we look at 5 years ago, and maybe even less than that, you know, there were very few treatments, if any, for melanoma. And look where we are today, and patients are living longer, especially with advanced disease, and there's even more, you know, in the marketplace. But the concern from payers are these therapies are becoming more targeted, and they're also becoming combined. So that adds costs. So there's a benefit, you know, and not a benefit, I guess, to the payers in terms of that, while there's such a great benefit to the patients. So, you know, from a payer perspective, you really need to understand, you know, how are these products going to be used? What are the advantages? Are they first line, second line, third line therapies? You know, should they be combined and which ones? And then really just managing to the appropriate use of the medications, keeping it on label when possible, and those types of things.
Many challenges to both specialties and payers. Thank you.
And as you get additional drugs approved with similar mechanism of action or that target similar mechanisms of action within the cancer realm as well, you have the ability to look at those and maybe do some comparative effectiveness in the real world and then begin to have the discussion whether or not it's appropriate to tier some of those therapies within the benefit design.
Very good.